Hi. So, who am I? I'm Dr. Jessica Beachkofsky, a clinical psychiatrist practicing for over a decade with a passion for psychoeducation, whether for colleagues, patients, or just interested humans. I served in the military for 12 years, beginning my training at the military's medical school and completing residency in San Antonio, Texas. I have experience working in military and veteran outpatient clinics, running an inpatient psychiatric hospital unit, working virtually in corrections, community clinics, and also private practice, which is what I do now. I've previously held adjunct professor positions and taught in the graduate medical education program, providing medical student, intern, resident training, as well as grand rounds for continuing medical education units. All this to say, I love the brain and learning and teaching about mental health. Nothing gets me more excited than sharing cool psych stuff with curious mental health providers. I create these short courses to minimize fluff, get right to the topic at hand, give you the recent updated research and standards of care with examples of cases and action points to make it easy to take what you learn here and apply it to your own clinical practice. I want you to feel excited by what we're learning in mental health. And I also want your clients to benefit from this too. So please share what you learn with them. As a disclosure, this is not a replacement for mental health treatment and is informational only. I am not providing any direct mental health supervision or consultation through this course. I love teaching and sharing information, but I'm not a researcher. I'm a practicing clinical psychiatrist who likes to read nerdy journals. Also, please practice within your scope. I provide this information for personal and professional edification and education only. Now, here's a little note about some of the words that I use. When I talk about people that I prescribe medication or who are prescribed medications, I generally refer to them as patients. I know not all therapists refer to their clients as patients, so I will also use the word clients when I'm not speaking directly to medications. Sometimes I also just words people or humans or organisms even, just to denote somebody who's doing something of note for us. But I think this is an important distinction because I do recognize that not all the people that you see will be considered patients. But for me, I engage in a special relationship that is the doctor-patient relationship. So to me, they are patients. Hope that's clear. So hopefully you'll find this little brief course very interesting and action oriented.